Hello, and welcome back to another episode of Straight Up with Steph. Today is such a great episode because we're talking about time management, specifically for dental hygienists. I know when I first got out of school, this was an issue, and I graduated like 16 years ago, and it's still an issue when I see patients. We have so many things to do, and I feel like the list is just getting longer and longer and longer. But what isn't growing is the time, right? We're not allowed any extra time. And for some of us, our time is even getting cut shorter. So time management is huge. Today, my guest is Kathryn. She is a time management expert. She actually coaches dental teams, not just on time management, but how to incorporate different hygiene systems in their practice and really elevate the hygiene department as a whole. And she's got a lot of really great tips for you that you can put into practice right away. We also talk about how important it is for the entire dental team to all be on the same page as far as what the patient should expect during their hygiene appointment, especially those new patient appointments when everyone comes in just wanting their cleaning. And we all know that that may or may not be the case for them. But it's really important for the entire team to be on the same page for patient care, but also just for the overall flow of the practice. Kathryn has many passions, and another one of hers is the oral systemic link and biological hygiene. So we talk a bit about that towards the end, what that means, and how people can learn more about practicing in this truly preventive way. Hygienists are preventive experts, but from what I've heard from a couple guests I've had on this podcast lately, I'm kind of thinking about this in a different way. When we think about traditionally what we do as hygienists, we're probing, we're looking at x-rays, and sure, if someone has periodontal disease, we can see it because the damage has already been done. What if we can screen these patients way before the damage actually happens in the first place with using microscopy or microbial testing, things like that, to really get ahead of the disease so that we can actually truly prevent it in the first place? It's really exciting, and Kathryn has a lot to say about that. I hope you enjoyed today's episode with Kathryn. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Miss Kathryn. How are you today?
I'm doing great, Stephanie. I'm so glad to be with you.
Oh my gosh, I'm so excited. I have seen you, of course I see you on social media. I know who you are because you're pretty well known in our little field of dentistry. And I've seen you at some shows here and there, but I haven't really been able to chat with you. So I'm excited to pick your brain a bit today.
Yes, I know. I was trying to think back to when I first knew of you, and I can't even place it. I feel like I've known you for a long, long time.
It's probably just because I'm like annoying on social media. I'm always posting stuff. So, but I was reading about you in preparation for this podcast. So I stalked you a little bit online and I saw that you have been a practicing dental hygienist for 4 decades now, which
Yes.
just blows my mind. I feel like I've been here a long time and it's only been 16 years and it's nothing compared to you. But that made me wonder, has time management always been an issue in hygiene appointments, even like when you started? Because it's certainly an issue now.
It is certainly an issue now, that's for sure. It's very different now. When I started, I think the majority of dentists felt like hygiene was a loss leader. And so there weren't as many expectations on us as there are now. Whatever expectations we had, we put on ourselves. And I happen to have been very fortunate in a couple of ways. I was brought up to be very exacting. I had high standards for myself, and I lucked into having a mentor at my first job who you may have heard of in our little world of dentistry, as you say. Anne Guignon was my mentor in my very first job. And so she helped me set really high standards for dental hygiene practice. So we had quite a list of things that we did for all of our patients. However, for the most part, I would say my friends had a more relaxed time with their patients. There was more chatting. It was very personal. We did all create really great relationships with our patients, and I still to this day feel like that's very important. But now, with technology and with understanding oral systemic connections and that we have an impact on our patients' whole health, the expectations are higher and the time feels like even more of a squeeze. So I totally understand how that is, that looking back, it seems like dental hygiene used to be much easier compared to what it is now.
When you said lost leader, I got a little flashback of when I was in school, and that's how they referred to hygienists, was a lost leader. And I was like, I don't really know what that means, but that doesn't sound good. But then when I got out into practice, even back then, at least I was expected to produce and be productive. And I was like, this is kind of the opposite as far as what I was taught in school. Do you think because of the whole insurance thing, how insurance reimbursement has not kept up with the times, do you think that is a factor too in all of the duties we're now expected to do to be productive? And insurance has kind of had a, like played a part in that?
I think insurance has definitely played a role. We all know we're not reimbursed anywhere close to the value that we bring to our patients, dentists or hygienists. So that's definitely a problem. I think more so, the need to be productive comes from the pressure on dentists. And that does come from insurance, actually, now that I think about it, because they have these enormous school loans to pay off, many of them, and enormous loans just setting up a practice. If they're the only one producing at a high level, that's a lot of pressure. So if they can bring in dental hygienists, who are the only other type of producers that we have in the field, that could really help alleviate some of the pressure and bring more balance to their lives. So when we work as a team and we're all producing at our highest, doing the best for our patients, I think that's a much better way to practice, and it certainly can take some of the stress out of our dentists' lives for sure. But then again, it adds stress to the lives of the hygienists when you have a production goal to meet. So one of the things I do as a consultant or coach is I help teams understand that we can be very productive while doing the very best for our patients. And that's a real win-win-win.
Oh, yeah. And I know that you work with Rachel Wall in Inspired Hygiene. That's how I found you, actually, because I really wanted to do an episode on time management. I know that I myself, I still struggle with that. I still see patients and I struggle with that. And I just can't imagine the pressures on like a new grad coming out with all these things they have to do in an hour or less. Would you say with your clients that you work with, is time management one of the biggest issues that you see?
It's definitely an issue in every client team I go to. And I still occasionally see patients myself. And the same thing goes for me too. It's a struggle even with an hour. So I understand, I can relate to my clients. I do share tips for time management. My biggest thought is that it's about our mindset too. We have to get very clear about what's the most important thing that we can do for our patients, what are the priorities, and what could we bring them back for if need be. And I think it's really important too that doctors make it clear to their hygienists that we have autonomy to decide whether or not we can complete everything during that appointment. And as long as the doctor and the hygienist are aligned in what the priorities are, then there should be less stress, less pressure for anyone who feels they can't complete everything. Do those most important things, and if need be, you can bring the patient back. Having that autonomy will help the hygienist feel less stressed about having to get it all done. And somehow what I see on my teams is that just knowing that they can choose to bring a patient back, they manage to make it work. So it doesn't happen all that often that we do bring a patient back, but just knowing we could really helps relieve some pressure from the hygienist.
Oh, yeah. I remember I was at a practice. The longest stint I had in an office was almost 10 years, and it was a fee for service practice. And the doc who owned that practice, he was very like, it's your department. If you don't have enough time, bring him back. If you need 90 minutes, go ahead. And you're totally right. Just knowing that I had the choice, I felt like just this weight was lifted off my shoulders, and I was actually able to get done a lot more than I thought I could. So you mentioned the importance of the whole team being on the same page. And I think that that's something that might be overlooked in a lot of dental teams. But how important is it for everyone from the front to the back to understand the expectations of the hygiene visit and for everyone to be on the same page?
It's everything. When we're
Yeah.
talking about making a practice run smoothly, having everyone on the same page is so, so important. From the office manager to the business team, when they're handling scheduling appointments, to make sure that they schedule the way it works for the hygienist or the dentist, obviously. It seems to be that I'm seeing a lot of comments on social media that maybe there's an agreement between the hygienist and the dentist that you could schedule a patient for 90 minutes if need be, or whatever the time is, just like you were mentioning. But at the front, they believe it should be done in 60 minutes, or they'll squeeze, quote unquote, another patient in because they're getting pressure from people over the phone who need to get to be seen. So there can't be disconnects between the different areas of the practice, and it's so important to make sure that we're all on the same page. Even when, let's use a business team member answering the phone and scheduling a patient as an example. So let's say the patient calls up and says, I want to schedule my cleaning, in quotes, because don't we all dislike that word because the way it undervalues what we do. So the patient says, I want to schedule my cleaning. If that business team member says, okay, and sets up the appointment, then when the patient comes in, that patient might be disappointed if the hygienist does all of the assessments and never gets to the quote unquote cleaning. We have disappointed somebody. We haven't met their expectations if something like that happens. Whereas if the business team member takes the time to explain what that patient can expect during that appointment, then we're setting that patient up for success because they're aware of what could happen. And you could certainly say, in the absence of disease, we would be happy to do your cleaning today or whatever. But that way the patient will know there's an understanding. I may have that procedure today, I may not. And that really sets the team up for success as well. I think also it's really, really important to use terminology that's consistent among the whole team. I actually had an experience where I went into a client's office and the hygienist told the patient that they needed non-surgical periodontal therapy, which is terminology that I really like personally. Non-surgical periodontal therapy, great. So the doctor did the examination and said, yes, I agree with Stephanie, you should have scaling and root planing. Okay, there's some confusion potentially. And then when the patient went to the front, the business team member said, let's go ahead and schedule that deep cleaning for you. So there were 3 different terms used for the same procedure. And when we create confusion that way, it's very easy for a patient to say no, because a confused mind always says no. So it's important that we meet together and discuss, what are we going to call this procedure? How are we going to approach it? What are we going to say when we answer the phone? How will we schedule our patients? All of those things need to be agreed upon as a team so that everyone is supporting everyone else to best support our patients.
That's such a good reminder what you said, but we just need to remember patients don't speak our language. They don't understand that we have like 10 different names for the same thing. We are talking about the same thing, but they don't know that. So yeah, a confused patient is a patient that says no, for sure. I remember at that practice I was at for a long time, the front was so good and we had a lot of coaching. I completely see the value of getting coaching for dental teams, but they just had it down as far as like what was expected in that new patient appointment. Yes, it's always our goal to get your cleaning done. Sometimes we can, sometimes we can't. We want to take the best care of you. So, and they came in with that. Maybe they're hoping that they get it done, but they also have been kind of warned that maybe it can't. What are some of your top time management tips for hygienists? Because I get questions about this a lot.
I'm glad you asked. We get questions about it a lot as well. And at Inspired Hygiene, we divide that typical 60-minute appointment into 3 sections. And it's called the 20-20-20. And I know other consultants use that same breakdown. And so the first 20 minutes are for assessments and data gathering. The next 20 minutes are for whatever type of scaling or recare appointment you'll do. And the last 20 will be for doctor exam and notes, reappointing the patient, patient education, room turnover, all of that sort of thing. So at the very outset, we make sure that everybody understands that if the scaling can't be done in 20 minutes, that's probably not a prophy patient. So there's one tip to make sure that you're properly assessing and treatment planning for your patients. My very top number 1 tip is to be early. So to be early is to be on time. To be on time is to be late. That's how I was raised at
Yep.
home and in dentistry, right? I love to be the first one in the office. It's quiet. And I can use that quiet time to review my charts and make sure that I'm prepared for the day. And I think that that's very, very important, especially if you're working with a partner in team hygiene. When you're working with a dedicated assistant, to have that time to review the day together is very, very important. The next tip is to be prepared. So make sure that your room or rooms are prepared with everything you could need. Make sure your trays are set up. I like to have everything. If I know I'm doing microbial testing for somebody that day, I'm going to have microbial test kits in my room. I always do anyway, but I'm going to make sure I have the proper number of kits so there's no getting up and running for something, especially if you don't have a dedicated assistant. So all those types of things. Make sure you're prepared by reviewing those charts too, that you know if somebody needs nitrous or any other special accommodations, that you're prepared for that ahead of time. The third tip is really funny, actually coming from me, because it is to limit chit chat. And
Yes.
anyone who
Thank
knows
you.
me knows that I have put very, very high value in my relationships with my patients. And to build relationship, of course, we have to communicate with one another. There's got to be that personal time, and creating deep rapport, listening actively, reflecting back to the patient. All of those things are very important, but we must take control of our appointments and know when to transition from that time of creating rapport with somebody new or reestablishing that relationship with somebody that you've seen before and catching up with them to, okay, now it's time to focus on your health, because that's why they're there. As much as they love us, as much as we love seeing them, it's not a social visit. So we must use our time to focus on the patient and why they're there. There will be time at the end of the appointment, possibly, that you can have a little more personal time, or when you're doing maybe a scan, you can chit chat just a little bit, but make sure that you then point out to the patient what you're seeing in your scan or in your radiographs or whatever you're doing, so that the conversation always goes back to the patient and to their health. So limit chit chat.
I'm really glad that you mentioned that, because that's one of the things that I say the most whenever someone's asking advice. I'm like, stop talking so much. Like, and also when you're talking, I worked with a hygienist constantly running late, constantly like 10, 20 minutes late. She'd always need help, like turning over her room and stuff. And honestly, it's because she spent the first 20 minutes literally just sitting there talking to her patient. But we can multitask when we're talking. We can take the blood pressure. We can get things set up in the room, get the x-ray set up, whatever it is, do some chart notes. Like, hygienists are like masters of multitasking. And so I think with chit chat, we definitely need to at least make sure that we're doing something productive as we're chatting. Sorry, next tip.
Yes, no, that 100%. And my next tip is multitask. So you're
Okay.
absolutely right. There are moments when we need to be knee to knee, eye to eye, heart to heart with our patients. And we have to have the sensory acuity to know when those moments are. But the rest of the time, like you said, we can be doing something else. When our hands are in our patient's mouth, that's a good time for us to talk.
Mhm. Yeah.
And we could remove our hands and they can answer if we're asking a question. But I agree with you. It's a big time waster if we're only talking and not doing something else. And that's not being productive. It's not being effective. And I don't think it's being respectful, because at a certain point, we have to account for what we're doing. I'll leave that there. And we'll go ahead and talk about multitasking too in another way. What I really like to do is think about my appointment in being the most efficient possible in my workflow. So when I'm doing my head and neck cancer screening for every patient at every appointment, I'm also doing an airway screening. I'm looking for signs of sleep disordered breathing. I'm looking for signs of TMJ dysfunction or occlusal dysfunction. There are so many things that we can do and see at the same time, and it makes sense to combine those things. I think also we could be dictating chart notes while we're scaling if we have a dedicated assistant or if we have AI. There's so many ways that we can use our time more efficiently if we think about it and if we're proactive about it. So I love multitasking. The next thing is to use the best technology. Using ultrasonics versus manual scaling is so important, not only for efficiency, but for effectiveness. We know that's the best way to remove biofilm. when we're using manual instruments, because there are times that it's appropriate to use our manual instruments still, then we want to use the best ones. If we use and this is actually an ultrasonic instrument, the Duratip by Parkel, it is effective even up to 3 millimeters of wear, that ultrasonic insert. That's amazing. So we're going to be efficient and effective if we choose our instruments wisely. The next tip that I have is to delegate. I love doing team hygiene or assisted hygiene. When you're working with someone who's well trained as a partner to you, I don't think there's any better way to feel totally supported as a hygienist than to work that way. When I had an assistant, I felt like I was a dentist. I felt like I could concentrate my time doing what I do best and have someone there to support me, to help me to take up the slack and do those things that make me less efficient. And it's a wonderful way to work. It's very different from double hygiene. It's very different from accelerated hygiene. That is not what I'm talking about. But team hygiene is a wonderful way to work. It's very efficient. And when you do it well, your patient will feel more cared for rather than feeling like they are on a track just being passed from person to person.
I love that you mentioned that. And it's funny because I had Rachel Wall on my podcast a while ago, and I said accelerated hygiene. And she's like, nope, hang on. We're going to call it assisted hygiene because that's not what we're talking about. And I've done that both ways. I've done it the bad way and then I've done it the good way. And it can really work. But you have to have an assistant that is like skilled, trained. You guys have systems, you've been trained together. This isn't just grabbing someone from the front and bringing them back and having them polish your patient real quick or try to take some x-rays. Like, that's not what we're talking about. And I know that you at Inspired Hygiene have a whole program, right, on how to start doing assisted hygiene in the right way.
Yes, we do. We do. And it's a beautiful thing. And it's a real difference from assisted chaos. That's what I call accelerated hygiene.
Yeah. It can be a nightmare.
It can be beautiful.
It can be a nightmare.
It's not really effective for anyone to work that way. And it's certainly not fair to a hygienist to have that much chaos and stress. And it's not fair to the patient because they don't receive the attention and focus they deserve. But when it's done well, which is what we teach, people feel better cared for. You've got somebody there to help you. When you do an examination and make notes for the doctor's exam, then the doctor feels like their 4 eyes are better than 2, right? So we're seeing things sometimes that the doctor could miss because they don't have that kind of time. It's the same thing when we have an assistant. They may pick up on something that the patient says or does that we might have missed. So we take better care of our patients when we do it well. So definitely reach out to us at Inspired Hygiene if you want to learn more about that. It's my favorite way to practice.
Well, I'm just hoping that this type of system can be a solution for some of the issues that we're seeing right now with like low production in the hygiene department, maybe. And then the real scary thing is non-hygienists being allowed to do hygiene duties. I don't think a lot of us want that, but I understand that people are looking for a solution. And I feel like this assisted hygiene, when done the right way, can be a very productive way to solve some of the issues that we're having.
Absolutely. And some of those non-dentist practitioners, non-dental hygiene practitioners could be our partners. And I think that's a great solution to the problem with access to care when there's not enough hygienists and we need more patients to be taken care of. They could be our partners and we could work at the highest level of our licenses. And those people could come in and do those things that it's okay and safe to delegate. I think it could be a really great answer. It takes some practice, it takes time, it takes effort to train well. But when you train well and work together, like just a beautiful flow back and forth, it's a great thing, as you've experienced yourself.
Yeah, and it does kind of free you up to do some of these things that I bet a lot of hygienists wish they had more time for, like airway screenings, microbial testing, laser treatments, whatever it is. But honestly, some of us, we just do not have the time to do what what's already on their list, let alone like adding more things. So speaking of what's on our list for our appointment, usually we have, a checklist of things we want to do for hygiene. I don't know. It's like 30 things that we're trying to get done in an hour. But what's your advice to someone who is constantly having to skip things or running late and just realizing that they cannot get all of this stuff done in 45 or 60 minutes?
Piece of advice number one is if you have less than an hour per patient, have your dentist call me, because that's impossible. I truly believe that's impossible to do the best for our patients in less than an hour. I would really think about assisted hygiene if that's the case, so that you can have a partner help you to manage all of the things that we need to get done in an hour. The other thing to do is to discuss with your doctor what the priorities are. As I said earlier, what can you delay, what needs to be done now, and make sure that you do those most important things. And I'll tell you from personal experience, what you never, ever, ever should skip is that head and neck cancer screening. I did it once. It ended in tragedy. It's a story for another day, but I will tell you, never skip that exam. What could be more important than the life-saving screenings that we do? If you want to go from being a loss leader to a lifesaver, focus on those assessments.
That's a great advice. And I think that that's probably maybe one of the first things to go if someone's tight on time. They're just like, forget it, I'll do it next time, maybe, because they just don't have time. But you're totally right. How do you handling the patient who just wants their free cleaning when they're actually perio?
That's such a good question, because it happens to all of us.
Every day.
Every day, right? It happens. So some people say for risk management, you must dismiss those people. And other people say have them sign a form that they have declined treatment. We all know that doesn't hold up in court. It's no way to manage the risk. So again, we have to have a conversation with the doctor and make sure that the doctor and hygienist are on the same page and understand what the plan is. So if this happens, how will we handle it so that each time it's not a crisis? Like, what do I do? The doctor has the say in at what point that patient should be dismissed. And that depends on their level of risk management and their level of comfort with risk. But the reason it has to be a conversation between the two or the multiple hygienists and doctors is because we all hold licenses and we are all at risk. If that patient deteriorates to the point where then they lose teeth, lose health, and come back and heaven forbid, sue us. So we all have to be part of that conversation and determine at what point we will say goodbye to that patient. I truly believe that we should have at least one more opportunity to improve our communication with the patient before we say goodbye. So I take it upon myself. I believe that my patient, by declining treatment, is actually not rejecting me, but saying they need more information. They may not need it that day. They may be overwhelmed, and I may need to stop talking that day, but I want to bring them back. I want to give them some tools to use in the meantime and some instruction for what they could possibly do to improve their health on their own, and truly in a non-judgmental way. Like, I want my patient to be healthy, right? So give them everything they can possibly do at home to help themselves. Make an appointment for 3 months from now to reevaluate, and give yourself the opportunity to say it a little differently next time. Give that patient time to process. Maybe they just need a moment, because we can have this very human reaction to being told that we have a disease. Somebody once told me it was a loss of a measure of health. We have an expectation of our health. And when we're told that it's otherwise, it can be very shocking, very upsetting. A lot of things start happening in our brains, fear, and lots of things start in motion. What will this cost me? What does this mean? What will I have to go through? Will it hurt? How can this affect my family? Lots of things happen in our heads while the practitioner is talking to us, and they may not hear what they need to hear. So I think we have to be as compassionate and empathetic as possible when we give that bad news to somebody. It's so every day for us. It's so run of the mill. Oh, periodontal disease, they need treatment. But if somebody told that to me, I would be devastated. So
Yep.
we have to take a step back and give them a moment to relax and breathe and take it all in, and then come back and address it again if they're not better. So I really try to talk people into not dismissing immediately. But then, of course, we can't go on and on and on doing a prophy when that's not appropriate. So that's where that discussion is going to come into play. At what point do we say, we've given it our best shot, but we can't go on doing this? So it is very, very tricky. But I would say at least have one more opportunity to help that patient accept treatment.
Okay. So, if a patient comes in, they've got perio, you've let them know they don't want to go through with SRP. Maybe in some situations, it's okay to do quote unquote a prophy. I mean, we all know it's not a prophy, but a prophy that day, having them come back in 3 months, reevaluating and revisiting, the fact that they need scaling. And then if they decline at that point, maybe it's depending on your philosophy and the practice philosophy, maybe it's time to dismiss that patient. Is that what you're saying?
That's almost what I'm saying, yes. And
Okay.
instead of calling it a prophy, excuse me, I might call it intermediate scaling or some other
Yeah.
terminology, because I don't want to use the prophy code when it's inappropriate, because that's fraudulent.
Yeah.
I don't want to set us up for problems that way. So I might do some intermediate scaling. I might do more education and getting some tools in my patient's hand that they could use, and not do a complete prophylaxis if that's not the appropriate treatment. I would probably handle it that way. But yes, bring them back in 3 months, as you said, give them an opportunity. If they still decline treatment, then you have to have that discussion. I will also say, as a hygienist, I've never dismissed a patient. I truly believe that's the doctor's responsibility and purview and right. So I would bring the doctor in at that point and let them have that conversation with the patient. I have seen a
Okay.
doctor save the day because the patient would say no to the hygienist and not to the doctor. So that could happen too.
Yeah. I mean, if you guys are on the same page, the doctor having your back, like it's a beautiful thing. And I mean, we all know that patients, they hear the doctor differently than they hear us. And so if they've got our back, that can definitely work. I love what you said too about really just, using our empathy with patients and meeting them where they're at, because you're right. We talk about perio all day long. We're probably diagnosing it all day long, but we're not thinking how that feels from the patient perspective. Like we're telling them that they have a disease and they have this irreversible bone damage in their mouth. I myself personally am a processor. I'll hear something, but I need to sleep on it at least for a night or two. And then I'm like, okay, I get what they're saying now. So I totally get what you're saying with our patients. Maybe we just need to let them think a little bit about that.
Yes, I think so. I think so. Not to be too
Yeah.
quick to jump in, and certainly not to judge. Sometimes we take it personally when they don't want
Yeah.
to accept treatment, and it's not a rejection of us. It's really that they need some time to understand and to process what's happening.
We all know that our patients are going to go home and Google, like, what is periodontal disease or what is bone loss or whatever. And that can actually work in our favor if they start seeing things that maybe they're like, oh, yeah, that is me, or I've had those symptoms. Maybe they're telling the truth. And then in 3 months later, they could be a lot more receptive to us. I know another passion of yours is oral systemic health. And I was reading also that you are a biological hygienist. So, what does that mean exactly?
Thanks for asking, because you're right. It really is a passion of mine. And I believe every single dental practitioner, actually, I'm going to step back, every single healthcare practitioner, in my opinion, should be interested in oral systemic connections, because we have enough research now. We know enough. It's indisputable. The mouth is part of the body. This may be news
Yep.
to some.
Surprise, surprise.
Right? But it's all connected. And so we can't expect that treatment in one part of the body might not affect another or be affected by the condition of another. So we have to consider the whole person when we treat our patients. So that is the very foundation of oral systemic connections. We should all be interested in that and use that to inform our treatment of patients. We'll see better results, I know. And biological hygiene builds on that, biological dental care. And the philosophy is basically about the fact that the body is meant to get healthy. It's meant to find homeostasis. It's meant to self regulate. And we can support that. And what we help patients with will either support it or not. And if we think of the whole patient each time, then we will choose treatment for them that will help their body regain its balance.
Okay, so biological hygiene it's not like a credential per se, but it's more of a philosophy on how to treat our patients holistically. Is that right?
Well, it is definitely a philosophy, and we are definitely credentialed. So you can earn certifications in biological dentistry and also in biological dental hygiene. And I have certifications through the International Academy of Oral Medicine and Toxicology, IAOMT, and also through IABDM, which is International Academy of Biological Dentistry and Medicine. I forget the order
Okay.
between medicine and dentistry.
These acronyms
IABDM.
just they kill me. No, that's good. So if someone wants to learn just more about what biological dentistry is, or maybe even get some education, are those some good places to start for them?
They're excellent places. That's where I learned. I've been interested in this, I feel like my whole life. And it took me a long time to find those types of practitioners and those types of courses. Both of those organizations have tremendous CE courses, even beyond the certification courses. I'm speaking there this week, in fact, at IAOMT. There will be
Awesome.
amazing speakers. The conferences are always full of great people to network with and to connect with because it's a very small community. If you think dentistry is small, biological dentistry is tiny, but growing. And it's so great to be around people who have a similar philosophy of care and who can help support you as you transition from being in traditional dentistry and expanding your practice to becoming a little more holistic or a whole healthcare centered. So it's really nice to have these connections and great classes.
What are some things that differentiate, let's just talk about hygienist, like a traditional hygienist from a biological hygienist? Like, are there more screening type things that a biological hygienist would do versus what we see in regular practice?
I think so. Even though most of the screenings are available to everyone, they're not in place in most traditional
Yeah.
practices. So, as you mentioned, microbial testing, that is absolutely vital to find out what bacteria, viruses, fungi, parasites, what's happening in there. So, we'll use phase contrast microscope, we'll use microbial testing. There are blood tests that can be ordered, all sorts of things that will give us an idea what's happening in our patient's gut, what's happening with their nutrition, what's happening with their airway, all sorts of things that we can look at and use to inform our treatment of that patient and our diagnosis of the patient. So, yes, there are probably more adjuncts as well that we will use. So, things still that are available to others, maybe we're going to use ozone, maybe laser, maybe pre and probiotics. Maybe we'll be doing some homeopathic microbials versus antimicrobial medication, that type of thing.
I just think that this type of philosophy or credential of biological hygiene is truly prevention. I've had a couple people on my podcast recently and they've both said this, and it's kind of made me look at what we've done traditionally in a different way. But it's like, yeah, we've got a probe, we've got x-rays, we can diagnose disease, but it's already there. Like the damage is already there. It's already happened. What if we can screen for things and identify bacteria that hasn't caused damage yet, but it's going to, and then we can like curtail it. So it's like hygienists, we do think of ourselves as prevention experts, and we are, but are we truly practicing prevention? Like, I don't think so, unless we're doing this kind of
Right.
thing.
Right, right. And it's not that we don't want to, and it's not that we don't spend time educating our patients and helping them help themselves. But you're right, so often we're looking at bone loss, we're looking at signs of previous damage. So if we could intervene early, it's very exciting. And one of the things I really like to do with microbial testing is make sure that people who are planning to have an implant do that testing before we do the implant because we know there's certain bacteria that will cause periimplantitis. What if we treat the patient, even if they don't have signs for periodontal disease yet? What if we get their microbiome more in balance before we do that surgery? Could their outcome be more successful? I think so.
Yeah,
Yes.
and it further like reinforces our role as hygienists and as prevention experts. I just hope that, with everything that's going on right now, yeah, there is some scary stuff that's happening and our profession is kind of in an uproar, but I'm hoping that this could be a catalyst for change and maybe we can all start practicing the way that we really really want to for a lot of us, which is practicing true prevention like what you're doing. So I think that's
Yes.
great.
You don't have to jump in with both feet and get
Okay.
certified and become a biological hygienist. You can do small things to transition your practice little by little. And one of the things that I bring to practices when I coach them, if they're interested, is something small like, what if we had some alternatives to fluoride for those patients who prefer not to have fluoride? That's a hot topic right now.
Sure
So,
is.
whether or not you are a staunch believer in fluoride, it's really up to your patient. So, most practices don't have alternatives available, and they'll say, well, okay, if you don't want fluoride, bye, you're done. So, I would say, you know what? We want to prevent dental caries disease, and we can do it with fluoride or we could do it without fluoride, whichever you prefer, and have those alternatives for in office products as well as products for them to use at home. Because the bottom line is we want to protect them, we want to be preventive. So even something small like that can get you started on this path.
That's a really good thing to note because I know myself when I'm wanting to make a change, I go ham and I change like 10 things at one time and then I can't maintain it. And then I just go back to what I was doing. So I think that's good to start small. I actually just recorded a episode on nanohydroxyapatite too, because that is a hot topic. And I think it's important to just realize no matter what your position is on fluoride or whatever, just because you're maybe talking about nano more doesn't necessarily mean that you're anti-fluoride. Like we've got patients that have different philosophies, different needs, and it's just more tools in our toolbox to help them.
That's such a good point. And the other thing that makes me think of is that I read somewhere that 50% of what we learn in school will be disproven within our lifetime, because we know research is ongoing. So we can't hold fast to
Yep.
these things that we were taught and that we believe. We really have to keep up with the science. So maybe the science is going to show us that fluoride is not in our patient's best interest. I don't know. I'm a biological hygienist who's a little bit caught in the middle. There are all sorts of people on this spectrum, and we don't have to be necessarily black and white in my world. I think it's good to have choices and to know that as long as we stay open minded and keep reading research and keep vetting research to make sure that we're reading good scientific journals and good scientific papers, then we're doing the best we can do. And know that sometimes it's going to be hard to realize that what we learned might not be true. But if we're true scientists and true healers, we have to stay open to that.
Yeah, and science evolves and we have to evolve. And it's okay to change your mind about something if the science supports it. It's okay. I think some people just have this death grip on fluoride because that's what we were taught in school. But it's like, maybe it's not the best thing. Maybe there's something out there that's better, and that's okay. Like, we just need to be open to that. So yeah, I'm glad you mentioned that. Before we wrap up, do you have anything like new that's coming up that you're excited about?
I do. Thanks for asking. Yes. So, my partners, I've partnered with Barbara Tritz and Frances Horning, who are two amazing biological dental hygienists who have worked with me to create something called RDH Boost. And that is a biological mini hygiene residency. So, it is hands on work so that our hygienists can take what they've learned in the certification courses into their practice and actually implement change. It's so easy to go to a course and learn all these new things, and then you go back to work on Monday. It's like, well, what do I actually do? Where do I start? So that's why
Or
we
you
created
forgot it?
RDH Boost, right? Because it can be very overwhelming. There's so much. Boost
Yeah.
stands for Biological Options for Oral Systemic Therapies. So we had our first conference in January of this year in the Woodlands, Texas. Our second one is being planned right now. We'll be in New Jersey, 45 minutes outside of Manhattan. So I'm excited about that. We will be there October 24th and 25th. And it's 2 days of hands on and lecture so that people will actually be able to implement some of what they have learned And we're also creating this network that I talked about where people can reach out to each other and support each other in this change. And we'll have real processes, protocols, systems to implement so that they can really feel like they're making strides and elevating their practice. Really excited about that. And then we hope our third one will be on the West Coast. So we'll try to keep traveling around the country.
Oh my gosh, that's really exciting. It sounds like it's for the person who wants to learn about biological hygiene, but also really is ready to make some changes. And you're just going to kind of lay it out for them as far as how they can do that. So that's awesome.
Yes, yes. We're very excited about it. The first one was super fun, and we just keep refining as we go.
That's just, it's amazing. I see hygienists and dentists too that are organizing these in-person events. And I wouldn't even know where to start. So I just kudos to you guys for figuring that out and doing it. I'll make sure to link that down in the show notes too, so people can find it. And then if anybody wants to contact you or get in touch with you, what's the best place for that?
Best way to reach me would be Kathryn at inspiredhygiene.com.
I'll make sure to put that down in the show notes too. Thank you so much, Kathryn, for your time and your expertise today. I know this is a very much needed topic, and I bet our listeners are going to get a lot from you. So thank you for your time.
Thanks for having me, Stephanie. It was fun.
You're welcome. And thank you, everyone, for listening, and we will see you next time.